Hello, I'm Emily, a Senior Research Associate from the University of Bristol. This is a summary of my ResNet study looking at the impacts of COVID-19 on young people's mental health. So this is in collaboration with my colleagues from the University of Bristol, early career researchers from UCL and Newcastle, and in partnership with the Mental Health Foundation. Just some background on the study. So I think we're all fairly familiar with the context of COVID-19, but why I'm particularly interested in young people, we've seen lots of news and headlines on the impacts of young people specifically. So just to highlight some of the language that's being used and some of the recent headlines I've seen. And as we can see, some quite negative language around scarred for life, being a lost generation, the class of COVID-19, thinking about older adolescents and school leavers facing uncertain futures. So this was in contrast to our recent study that was published, which really formed the basis of this ResNet application, as it raised more questions than answers for me. So we saw a reduction in anxiety levels amongst 13 to 14-year-olds. And this was in schools across the southwest of England. But the questions it started raising for me was the impact of the school environment on young people's mental health, and needing to understand why we saw a reduction in anxiety, what were the kind of reasons behind this, and also if this says anything about the particular age group, because we've seen quite different findings among older teenagers. So the study outline for my ResNet project, I'm looking to really understand whether there are specific groups of young people who have poorer mental health and wellbeing after lockdown, to also understand experiences in more detail. So the way I'm proposed to do this is by both a quantitative and qualitative study. So the quantitative study will look at analysis of a third time point. So there's an ongoing study going on currently in schools, which I'll be analysing the findings of. So as I said, looking at more kind of longitudinal impacts and whether those kind of differences in anxiety we saw have changed now young people have gone back to school. And the qualitative case study, I'm hoping to focus that specifically on groups we know to be at risk. So I'm hoping to sample 2 to 3 schools in areas of deprivation, but also with larger Black, Asian and minority ethnic populations. So we found less BAME students and those receiving free school meals took part in our lockdown study. So we're really interested to hear from those young people in particular. The timeline, I've submitted ethics. I have also been fortunate enough to hold an advisory group with some young people already. It's a year-long study in total, so I'm hoping to do the teacher interviews for the qualitative study before Christmas with the student focus groups after Christmas, and I'll be recruiting schools in the next month. So just to share with you some initial PPI findings I've found from speaking with staff and young people. So these are the ideas from staff. So for both the staff interviews and student focus groups, I'm going to be splitting the conversation into kind of experiences of lockdown and then experiences of returning to school. So some ideas from staff largely centre around the impact of COVID-19 on young people's mental health, also their educational outcomes, but really thinking about also the impact this has had on staff mental health and wellbeing, and hearing the experiences of how lockdown was as a school teacher. And in terms of returning to school, lots of questions coming up about social distancing measures. Is there an additional support required for either mental health or kind of academic catch-up? And the idea that maybe there might be a shift now away from kind of academic catch-up onto supporting mental health and well-being. And students, a lot of students' ideas were focused around social relationships. So friendships, how young people were connecting with friends and peers during lockdown, the impact of social media on that ability to connect with friends, but also just really understanding what young people struggled with most, or perhaps what went well for them during lockdown. And returning to school, there was a lot of focus on safety and the ideas of anxiety and around rules being put in place by the government, but perhaps those not occurring in schools, and young people were particularly concerned around how they can keep their friends and family safe now they've returned to school. So there's some of the initial ideas that I've managed to speak with young people and staff about. And what I'd like to get out of this study is I'll be writing the findings up in a peer review publication, hoping to present at conferences, probably virtually, and doing some policy work, hopefully with the Department for Education. And I'll also be providing schools and local mental health charities with reports of the results. And really, I'd like to continue collaborating, particularly with early career researchers in the school. And also, this is a great chance for me to develop my skills as an independent researcher. And I hope this will inform a future NIHR fellowship application as well. Thank you for listening. Love to hear questions if we've time.